Okay, we are live. Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Aparna Jha from Apollo Cradle and Children's Hospital. She's going to talk about women's health. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Thank you for the warm welcome. I'm Dr. Aparna Jha, working as a senior consultant in Apollo Cradle, Brookfield, Bangalore. Uh, Good afternoon, everyone. Good afternoon, my listeners. Today, my topic is I'm going to speak about, in general, women's health. International Women's Health Day is around, so we are going to talk about that. Uh, to be very frank, just now when I'm reaching up to you, the one bad thing I've done to my health is this that I'm still hungry. I haven't had my lunch, and I'll start my topic here. So we women, in general, anybody whoever when they become busy, the first thing what we ignore is ourselves, our body. We somewhere have this conception in mind that something which is non-living cannot be reproduced again, so let's take care of that more than ourselves, because we are living, so our body will reproduce again better and better cells. Unfortunately, it doesn't happen. There is a life to every cell, there is a lifetime to every cell, there is a shelf life to every human body. And the way we take care of ourselves, the better we take care of ourselves, the better our body takes care of ourselves, and take us a long way in a healthy way. So like if there is a dust on this table, I would, if I wanted to be looking good, I would keep dusting it. I'd keep taking those dust away, and then that's when this table would look beautiful. But the same, if I don't do, the table would not look good. This is what is called as taking care of your health. So non-living thing, if needs care, living things need much more care for that, more than that. Coming to women, we are the center point. We are the ones who produce. We are the ones who are to take the humanity or the generation further and further and further. So it's very important to take care of ourselves, not from only from the, I mean, not only at the age where we are declining, but from the age where we are building ourselves up. And building ourselves, I would differ from puberty. Till puberty, it is all the same, be it a boy or a girl. The health-wise demand and most of it is almost the same. But the moment we come to puberty, the moment the period starts happening, or the body changes start happening, the demand of several minerals, vitamins, folic acid, or hemoglobin, iron, everything becomes different for a boy and a girl. There's a misconception, and it's a major misconception, that every female has to shed out some amount of bad blood from her body every month. Yes, we do shed out blood. That there's nothing called bad about it. It's the same blood which runs in our body, which keeps getting shed out every month, and that is why the basic parameter of lab test of hemoglobin, if it is considered 14 normal for a male, 12 or 11.5 is considered normal for a female. Reason being this, that we have understood, or we have taken this into account, that every female will shed out some blood. So her blood 11.5 or 12 is considered normal. That doesn't mean that is sufficient. It is considered normal. Okay, that is because most of the females have that amount of blood. Okay, now we need to make sure that, because every month we shed out some amount of blood, so we should be taking care of that. A girl who's just attained her menarche, she may have very irregular periods. Her periods could be sometimes very erratic, very heavy, and sometimes for a couple of months she may not bleed. So the cycles are very erratic. So that is one thing. That is when we need to make sure that her hemoglobin doesn't go dip down, because the moment her hemoglobin dips down, from there she remains almost the whole life anemic. So please make sure that a girl who's having her periods regularly or irregularly, once she attains menarche, after that her hemoglobin, and not only hemoglobin, but her magnesium, her zinc, her vitamin B12, her vitamin D, all has to be taken care of. So it could be by extra nutrition, it could be by extra medication, or howsoever, but then her body should get supplemented of it so that she can get use of her, she can take use of her whole body, her whole strength equally as a male or as a boy. So that is one point which I wanted to cover at this point of time. Now, at the same time, at the time of puberty, I'm sure there is a lot of buzz around about human papilloma virus vaccination, that is HPV vaccination or cervical cancer vaccination. Again, there are a lot of myths about it, lot of myth, enough and more amount of myth, saying that unless a girl becomes unless a girl is married or sexually active, there is no need of cervical cancer vaccination. Or if the girl is not exposed to sexual diseases, sexually transmitted diseases, there's no need of cervical cancer vaccination. Or if a female is having her period, she doesn't require cervical cancer vaccination. There's nothing like that. Any girl who has attained menarche. In fact, now the latest guideline says that after the age of 9 years, the female should be vaccinated with cervical cancer vaccination, that is human papillomavirus vaccination. So please make sure that every girl who attends menarche or who crosses the age of 10 should be given HPV vaccination. Now, the upper limit of the HPV vaccination, there are a lot of controversies about it. Some studies say that till the age of 35, some say till the age of 45, some say till the age of 50. Uh, in in the experience of looking at the cervical cancer vaccination, what we can, as medical fraternity, what we can say is this, that there is no harm in taking cervical vaccination as late as possible. I mean, if at all, it's not been given early. At any age, it can be taken. Only thing is that the efficacy of the vaccination, of course, reduces as and how the age becomes more and more. So, cervical cancer vaccination can be taken at any point of age, even if you are having periods. Right now, when somebody is having her pregnancy, when somebody is carrying her pregnancy, there's no data sufficiently proven that it has any negative or positive impact. So we refrain from giving any cervical cancer vaccination when the patient is carrying pregnancy. So beyond to that, at any point of time, she can take her cervical cancer vaccination. I'm not going to do the details of the 3 and 2 doses that can be taken up. Now, coming beyond to that, as and how the lady grows, from puberty to once she gets into this reproductive age group, when she's already married or planning for pregnancy or planning to to have her baby. So that is the time when when we see a metamorphotic change in her body. When she would become pregnant, the demand of her body would almost the load of her onto her body remains almost doubles up, and the demand of her body also almost doubles up. So it is very, very important for us to know whether she is healthy enough to carry out the pregnancy or not. Uh, for that, there is something called preconceptional checkup. Before the lady becomes pregnant, she should look at it, that whether she is hale and healthy to carry the pregnancy or not, or if there is any demand of the pregnancy during the pregnancy which has to be fulfilled prior, or if she is already on any medication, any chronic diseases like diabetes, hypertension, or anything. For that, is she taking the right amount of medication, the right doses, and the right type of medication? If not, then that has to be changed over. uh, Mind you, this is not, I'm not talking about females who are trying to conceive and not being able to conceive. That's a different case scenario. That goes in a different direction. Every female, whoever is planning for pregnancy, should have her preconceptional checkup in order to make sure that she carries out a good, healthy pregnancy and she has a healthy baby as an outcome. That may all be there may be some blood tests required, there may be some scans required, some medication like iron, calcium, folic acid, vitamin D, vitamin B12, whatever is the demand of the body. According to that, that should be fulfilled much prior to pregnancy, much prior to conceiving, and then the lady should step into the pregnancy, that 9 months of pregnancy. Once she has conceived, once she has gotten into the pregnancy mode, during that time, it is important to take care of, for the female herself. She should take care of her body. It's not always expected to expected. Yes, good that you have a family member support or you have your husband support and everything, but then you should make sure that you take care of your body on your own. You should make sure that the demand of your body is fulfilled in terms of nutrition, in terms of rest, in terms of in all the ways, hygiene or everything. Many of the females are nowadays working female, because of which their body is anyways under stress all the time. So to make sure that during pregnancy they are having enough amount of time to have their exercises or have their walk, and have their time food, healthy food, homemade, home cooked food or healthy food, whatever, that is very, very, very important. Post delivery, again, there are lot of myths. In every family has a different kind of custom which the female has to go for, or the female has to, she has to take care of that custom. She has to make sure that she is into the border of those customs, to so called to take care of, to have a healthy baby further, and to have a healthy postpartum time. uh, there are many customs which are not exactly right, or which are not exactly so healthy for the postpartum female. Like, to name some of them, there are many places where they say that milk, if at all the milk is not sufficient, you should start making them feed a large amount of fat and carbohydrate and protein in terms of laddus or sago seeds and all that. Yeah, it's good to have nutritional valuable food, but then it is not at all good to overload the female with a calorie, because that will make sure that she will put on a lot of weight. Her BP may go high, her sugars may go high. The amount of weight she has already put on, which has pushed her towards obesity, will further make it her as morbid obese patient. Her wound, the episiotomy or cesarean wound, may get may not heal so well if at all she's super obese. So please make sure that you take only the amount which is required for breastfeeding. You should not overburden yourself with food. Same with water. There are many customs wherein they say that if water is taken more, the milk will become thin and the quality of milk will degrade down. No, that doesn't happen. Enough amount of water is very important in postpartum period. Likewise, there are sufficient and enough amount of myths which are there, which is important for us now to break those myths, to come out of that shell and to say that this is what is right and we should be doing this in order to make sure that we remain healthy, and as in how we progress in our journey of when we grow older, our bones do not become weak, our knees do not become weak, we do not get into hypertension or diabetes and all that. And for that, all these postpartum care is very important. If the postpartum care is not in a right way, then it may lead to many miserable things like severe backache, chronic backache, and if exercises are not done well, the body will not get the strength back, and the lady will not be so well prepared for a second pregnancy. The second pregnancy may get complicated. Now, coming from when we come out from this pregnancy, so-called pregnancy aspect, from there, when the lady is going into her perimenopausal age group, or when those are the changes which start happening from the age of, typically from the age of 44, 45 till the age of 50, 55, wherein there are many of them, they will have a lot of irregularities into their periods. They again come back to that puberty stage, so they'll have a lot of irregularity into their periods. They'll start having a lot of mood swings. There are deficiencies which start setting in, because this is the time when the kids are growing, a lady from 38 years of age to 45 years of age, the beautiful journey of taking care of their kids, of the family, wherein she continues to ignore herself. No proper vitamin D, no proper vitamin calciums, and no proper exercises. She starts putting on weight. And in this perimenopausal changes, she will start having a lot of these mood swings, and she's already miserable. Over to that, her body is not giving her, body is not cooperating with her, and this becomes kind of a miserable phase. So, just to make sure that you are hale and healthy at that time, you should be taking care of yourself also. You should actually start having those maybe the annual health checkups, or at least take care of your, meet a doctor if you do not feel good about some things, certain things. So you should go ahead and meet the doctor. There are some screening tests for cancers like cervical cancer, breast cancer, a pap smear test, or a cancer test, or an ultrasound, which may be required if there is a family history of any kind of these cancers. These are the ladies who need extra care or extra screening for her to get detected with the disease prior, if at all there is going to be one there to get detected, because a prior detection of these kind of carcinomas go a long way. The treatment differs a lot. It becomes much more conservative treatment when, if the disease, if disease like breast carcinoma or cervical cell carcinoma is detected prior, versus if it is detected later. So to be in touch with the doctor, to go to the doctor and to let her know that these are the problems. There are certain times when these abnormal uterine bleeding, like these heavy bleedings, because a female, she gets used to those heavy bleedings. She would not even realize that she's having heavy bleeding. When they come to us in the clinic, many of the times we see the hemoglobin being 7 gram or 8 gram, and the lady would be like, yes, I get tired, but I'm okay with it. So if you're getting tired, please don't be okay with it. Go to the hospital, go to your gynae, get to know that why you're getting tired. Is this amount of bleeding normal or not? Can you take? Is this amount of bleeding is normal or not, or is it heavy? Is it something which is concerning? Can we do something about it? Can we really make sure that your bleeding becomes lesser, and can we really make sure that your hemoglobin goes up and you feel much better about it? When you see yourself with 8 gram hemoglobin and a 12 gram hemoglobin, you will yourself realize that there is so much of difference between your own being self being feeling better or self feeling better. You will realize that there's a big difference. So please make sure that if you feel low, it could be, sometimes it could be just a hormonal issue, but still it has to be addressed. Now, hormonal issues, okay, beyond to this abnormal uterine bleeding, the hormonal issues, which is very easily, they are brushed off, saying this, that she's getting older, she's overworked, and that is why she's behaving cranky. Now, if you feel that you're behaving cranky, please try to figure out that why are you behaving cranky. You're the same person who was there 10 years back, being very sane, very normal, everything was normal. So all of a sudden, if there are some changes happening, probably we are the gynecists are there, or the doctors are there to help you around. So please do not ignore that feeling of being cranky or self worthlessness. These kind of feeling, if you're getting, please get back to your doctor. You may require some amount of hormonal replacement therapy, what we call it as HRTs, which are being nowadays pretty safe, and you can take them and you can feel much better about it. Yes, there are certain amount of changes which would happen in your body, which are ought to happen, for which we cannot do anything. But at least let's get to know whether we can do something about it or not. And if we can, we should try to get it done. Coming to the very last phase, like postmenopausal phase now, because of life expectancy being very long, uh, being increased, so the postmenopausal age group also has a good 20-25 years of age. Like if a lady attains a menopause at the age of 55, I mean, she has good 20-25 years to live. So Do not ignore yourself at the age of 55. Don't think that fine, done, all done, and my periods have stopped, and this is how I'm supposed to be now. My skin will sag, and my organs will sag, and it's perfectly okay to not look good, or it's perfectly okay to have some knee pain, or it's perfectly okay to have few fractures. No, it is not perfectly okay to have some fractures, or it is not perfectly okay to have those amount of skin changes which make you feel bad. The skin changes are okay. The body changes are fine, provided that you have accepted them happily. If you have not, then please go up ahead. There are treatments available for it. Please take them. The leg pain, the body pain, the knee pain, the back pain, these are not synonym of postmenopause. So please don't make them as synonym. Don't say to yourself that all my friends are having it. My mama also had it at the age of 55, so I will have it. Times have changed, things have changed. So there are much more what can be done, or and then what we can do or we should do in order to take care of you. But then for that, you have to take care of yourself first. You need to understand that this is a problem. You need to acknowledge the problem, and then go to the doctor for with the specific problem, and things will be taken care of. There are times when it will require your extra efforts, uh, uh, your extra efforts, basically, like walking around, like doing your exercises, making sure that you move all your joints on daily basis, maybe for half an hour or 15 minutes or 25 minutes, which makes a lot of difference. There are a lot of fluids in between these cartilages and all, which gets circulated, and your joints become much more free and you feel better. If your calcium levels are good, your joints will not go brittle, or your bones will not go brittle so fast. If your vitamin D level is better, you will make sure that it is not only your bones and skin which gets affected by your severe vitamin D deficiency. Even your intellect, even your intellect gets affected by your severe vitamin D deficiency. The chances of Alzheimer's disease or these forgetfulness, senile dementia, all these reduces when the vitamin D levels are good. So there are many things which are interconnected, which are interlinked. We can only make take care of them if we know about them, and if we acknowledge about them. So please acknowledge to your health. Please take care of your health. Please make sure that if you are not feeling good, go ahead and seek help, and try to make sure that you whatever is given to you, whatever advices are given to you, you take care of them. So you should take care of your body the same way as you take care of your kid's body. If your kid is not well, you will definitely make sure that the medications are given in the right time to the kid. But the same we don't do about ourselves. We keep ignoring ourselves, and finally when we end up in a situation wherein everybody else starts saying to ourselves that we kept telling you, you didn't take care of your health, and this is your problem, or this is your mistake. Let's not make it our mistake. Our health is our right. Our healthy body is our right. And let's do this. Let's make sure that we take care of this. So with this, I'll end up my session. If at all there's any question, I'm here for another 5 to 10 minutes to take them up. Thank you, listeners. It was nice.